Tora Jones, and this is Mr. WCC, and I need to give you a report.
Okay, what's going on with him?
He has a temperature of 38.1 degrees Celsius. His heart rate is 94. His respirations are 20. His BP is 110 over 68. His SpO2 is 94% on room air. He admits to having an affair about 3 weeks ago with another woman, but his wife doesn't know. Denies having any history of past illness. His wife is coming in to see him in about 5 to 10 minutes. We need to get him out of the ED because we have several patients coming in from a serious accident. We drew his blood work. You need to start an IV. Check the computer for his admitting orders. The resident said she would write the orders. I don't think he has any allergies, but I don't remember, and we need to get him out of here.
All right, okay. Thank you. Thank you. Mr. WCC?
Yeah, I heard what that nurse was saying, and I don't want my wife to know.
Okay,
anything.
understand. That would be up to you to tell her. We won't say anything, we'll keep that. Okay? How are you doing? How are you feeling right now?
I'm feeling really short of breath, and I'm really having a hard time keeping it together. I'm feeling like I'm really sick.
Okay, I'm gonna raise the head of the bed up so you can breathe a little easier, okay? That's gonna help expand your chest and get
Thank you.
a little more air into your chest. Okay? Do you have any allergies, Mr.
I don't know.
WCC?
I'm just really having a hard time breathing. I don't remember.
Okay. Well, let me give you some oxygen right now, okay? And we'll take it from there. This will give you oxygen directly into your lungs.
Okay. Will that help me breathe better?
Yes. That should help.
Mr. WCC, what I'd like you to do is breathe in through your nose and then out through your mouth. In through your nose and then out through your mouth.
It really hurts. My chest feels really tight, like I can hardly breathe.
And Mr. WCC, we also have nurse Mary here and also Athena. Her name is Casey. She's going to be taking your vital signs. Okay, like
What's my vital signs?
your temperature, your heart rate, and your breathing. And Mary's gonna put in an IV in your arm.
Will it hurt?
Just a little bit. You'll feel a poke. But Mary will tell you when she's gonna put that needle through.
Okay.
Okay?
Okay.
Any allergies?
I think I'm breathing a little bit easier. Does it look like I'm breathing easier?
Yeah, we're giving you 2 liter of oxygen right now. So we'll take it from there and wait a few minutes. If you need to take a few more deep breaths, that might help a little bit.
In through your
I'll
nose.
have to deep breathe. Hang on just a second. Let me deep breathe a little bit. And then I can answer your question.
Okay, all right.
Take the oxygen in through your nose, Mr. WCC, and then out through your mouth. In through your nose and then out through your mouth. In through your nose and then out through your mouth.
It looks like it was helping. Your oxygen level is
What was
improving.
my oxygen level?
It's improving.
I was a little worried. I think I'm breathing a little bit easier.
Oh, good. That's good.
You know what? I remember having a rash a couple years ago. Doctor gave me an antibiotic, and I think it had sulfa in it.
Okay.
I'm not sure.
Did you break out in a rash?
Yeah, I had a rash all over my body, and they had to stop it and switch me to something else.
Okay. Are you allergic to anything else? Any other food allergies?
I don't remember anything else that I've had. I've been really healthy. I've never been this sick before. I just feel so weak and sweaty. It just like I have no energy to do
bring you a cool towel to put on your head. Would you like that?
That sounds good.
Mr. WCC, are you allergic to any shellfish?
No, not that I know of.
Any eggs?
No, not that I know of.
Okay.
I eat eggs all the time and I don't have any problems.
Okay, so it's just the sulfa that you know of that you're allergic
Yeah,
to?
that's all that I remember.
Okay, thank you.
Here's a washcloth, Mr. WCC.
Thank you so much.
You're welcome.
And
Okay,
your name is?
My name is Casey.
Thanks, Casey.
You're welcome.
Mr. WCC, I'm gonna go take a look at your lab reports that they've taken when you were in the ER.
Yeah, they do blood work.
Okay, and then I'll come back and make sure that we'll probably end up giving you antibiotics, but
Okay.
I'll have to check everything, the lab work first.
Okay, what's an
and-
antibiotic? Oh, yeah, that's right. I
Mhm.
had that before a couple years
Right,
ago.
right, and you may have an infection, so,
They told me I had pneumonia down in the emergency room.
okay,
Is that-
okay, that's why
is
the
that right?
antibiotics.
Oh, okay.
Did they also do a chest x-ray down there?
I think they did, but I
Okay.
don't know. I was pretty sick, so I don't even remember, but I think they must have.
Okay,
Isn't that how they find out you have pneumonia?
yes,
Okay.
yes.
Then they must have done that.
Okay, do you need anything else right now before I go?
Maybe a glass of water.
Okay,
I'm really
can you get him a
dry.
glass of water and then do his vital signs? Mary, do you want to put in his ID, get that ready? I'll go check his lab report.
Okay.
We'll get- I'll be back in a few minutes, okay?
Okay,
Check
thank
on
you.
you, all right.
Oh, honey, how are you? You look so bad. How are you? What did they say? Did they say what was wrong with you?
Mrs. WCC?
Yes.
Hi, I'm Nurse Hannah. I'm here to take care of your husband.
Yes.
Mhm.
What's wrong with him?
Well, we think he has an infection. Actually, he has pneumonia, so we're going to be giving him some
Hi, Tom.
antibiotics.
How are you doing?
I'm doing
Thanks
wonderful,
for
hon.
coming. I just feel so sick. You know how I've been telling you the last couple days. I've just been feeling so sick. Didn't want to come, but I had to leave work today because I thought I was just going to pass out.
Oh my God,
They
you
said
don't
that I've
look
got
good at all.
pneumonia.
Yeah, and we're probably going to be giving him some antibiotics, and I'm going to check the lab work and, make sure that we're giving him the right medicine.
Do we know what could have caused this?
No, that's where the lab work
Okay.
comes in, so we'll take a look at that,
Yeah,
okay?
we have to take, he looks so bad.
Yeah, if you have any questions, Mary's here to answer some questions.
Okay.
Um,
Hi.
They
WCC.
gave me some oxygen and it's helping me breathe.
Do you know if he has
And
any
then
other
I have the
issues?
bed up so I don't feel like my chest is so
Is
tight.
that helping? Okay. Yeah, oh, I think he had an allergic reaction to sulfur. a
Okay,
couple.
anything else that you know of?
Not that I know of. He's
Okay.
been really healthy.
All right, okay, well, I'll be back in a few minutes,
Okay.
okay?
If you could just pull up a chair, just hold my hand, that would help me.
Okay, yeah, I must.
Mr. WCC, this is Mary. I've got my stuff, I'm gonna start a catheter. I'm gonna put a catheter in your hand so we can get an IV hooked up.
Okay.
We're gonna start with fluids right now because you're diaphoretic, which means you're sweating a lot, and so you're losing some fluids and your electrolytes. So we wanna get those fluids back into you.
What's electrolytes?
The vitamins and minerals that your body needs to work properly.
Okay.
Hi, Mr. WCC. It's Casey here.
Hi, Casey.
Hi, I brought you some water. Do you want to take a sip?
Yeah, do you have a straw?
I can go get one for you.
Okay, I appreciate that.
Okay.
Because I don't feel like drinking from a cup.
Okay,
Thanks.
right now, all I'm gonna do is put a band around your arm. It's gonna feel a little tight, and I'm just gonna be looking for a
It
vein.
feels a little tight.
Okay. I'm just gonna be looking for a vein right now.
Hi, I have a straw for you. Do you want to take a sip now?
Okay, yeah, thanks.
Okay, here you go. Is that good?
Oh, that tasted good. Thank you.
You're
That's
welcome.
nice and cold.
Okay, I'm going to take your vitals now too, okay?
Okay.
I'm going to take your blood pressure and your temperature.
Yeah, they're taking care of you. I really hate this happen.
Now it's gonna feel kind of cold right now because I'm just gonna wash your arm before I insert the catheter.
405. I have a patient, Mr. WCC, who was transferred from ED.
I'm just gonna let this dry for a little bit.
He had a chest
Cameron, take your
X-ray
temperature and
and,
put it under your tongue, okay?
Okay.
He is, his lab work.
Okay, you're gonna feel a slight poke.
Is low, 3100.
What was my temperature?
His CD4 is 189. His temp is currently
It was 38.7 degrees Celsius.
38.7.
Oh, I feel like I'm burning.
And, his, alcohol rate is 100, respiration.
Is
All done?
everything okay with his vital sign?
The nurse will talk to you about it.
Okay.
No, good.
All right,
I'm glad
thank
to
you.
hear that.
CO2 is at 92. Yes, he is. He's on.
Now I'm just putting a protective covering over this so to cut down on infection.
He's getting his IV put in. And I see that the order is for Bactrim. He is allergic to sulfa. So I suggest that he put on 10,
Do you need anything else, Mr. WCC?
so that we can get that started. We can write that
I
order for
think I'm
that.
okay right now. I just feel like kind of open.
Oh, yeah, okay.
Mr. WCC, now we're just waiting for the lab results and then we'll figure out what we need to give you medication-wise,
Okay.
okay?
They're gonna get you all better, honey. They're gonna get you all better.
Mhm. All right. Okay, all right. Okay, so you want him to be put on neutropenic precautions and bleeding precaution. Changes antibiotic to pentamidine, 4 milligrams per kilo, 24 hours. And you want an order for urine, 24-hour urine
Thanks
for
for holding my
creatinine,
hand,
clearance,
Laura.
and a
I
500
appreciate
milliliter
that.
fluid bolus
Oh, yeah, I
of
wouldn't be any other
0.9
place but
saline
here, dear.
over 1 hour. Okay, well, thank you very much.
They're gonna get you all better. I just know they are.
Okay, so he's gonna need
Yes, I can.
500 milliliter
Here
fluid
you go, you ready?
bolus,
Okay.
one saline, and then he's gonna get
Thank you.
You're welcome.
pentamidine, 4 milligram per kilogram.
Okay,
Okay,
All right.
if he, we don't have weight on him to get that done,
okay.
and then we'll do a 24-hour urine for creatinine clearance. We can have, I can have Casey get a sample of the urine.
Okay,
Okay, and we may need to do a sputum culture as well.
okay,
All right?
all right. So we can have Casey get the sputum and his weight for us.
And the urine,
Okay, all right.
yeah.
Okay.
Sample.
Casey, when you have a second, could you get Mr. WCC's weight, a sputum culture, and a urine sample for us?
Okay.
Okay, thank you so much.
Mrs. WCC, I'm gonna have to take this flower out of here. Mr. WCC, white blood count cell is pretty low, so he's neutropenic. And anything, any fresh vegetable or any fruits and fresh flowers
All right,
are
I'm
allowed.
putting together right now a 500 milliliter
Cause more
bolus.
infection, so we keep that away, and so we don't, bring
Let
any touch
it
food
yours.
from now, at least until, his
Okay.
blood count is normal again.
Okay, 'cause he usually has a fresh apple. every
Yeah,
morning.
no fresh apple,
Oh,
okay?
okay.
All right,
I don't feel much like eating anyway.
okay, all
I
right.
really don't, but
Yeah.
I know that was nice of whoever sent me the flowers. It's too bad that I can't have flowers in here.
Right.
And Mr. WCC, do you need anything else before I leave?
No, not right now. I'm hoping they're gonna give me some IV fluids.
Did you check
Yeah,
that? You checked it
I
out?
did, and he is a little bit dehydrated,
Uh-huh.
because he's been sweating, and, so Nurse Mary's gonna, be giving him a bolus of 500 milliliter of
So he
fluid.
has an infection?
Yes, he does.
Did they
She's
say what
also-
type it was?
is just an infection in the lungs,
Okay.
and we're just gonna give him antibiotics for that, okay?
Okay.
All right.
Well, they're gonna make you all better, huh?
Okay, Mr. Wells, what I'm setting up right now is just some IV fluids because you're dehydrated, and this will help you with your fluid levels and your electrolytes. To
Okay.
get those back up.
Is that what the doctor ordered?
This is what the doctor ordered, a 500 milliliter. So this whole bag that's hanging above your head is gonna go into you within the next hour here, okay?
Okay. What will I do if I have to pee?
You can let us know, we'll have a urinal ready for you, okay?
Okay.
Okay, hi, Mr. WCC, it's Casey again.
Yes, this
I'm
is
gonna
nurse-
have you spit into this cup for me, okay?
Okay, if I
Just
can.
wanna clarify
If my chest feels good,
antibiotic
I'm
order
gonna
that the
try.
Okay.
doctor has written. He changed the antibiotics to Contamin.
Thank you, we got stuff.
Because he had a sulfur
Yep, we did, thank you.
allergy,
Just hold it.
so I just wanna make sure that you guys have.
Yeah.
Right, the order is yes.
And what is that for?
All right, thank you.
Now this is just fluids right now that we're
Oh.
putting back into him because he's just been sweating so much.
Uh-huh.
He's losing a lot of his fluid and his electrolytes. And so this bag right up here, it's sodium chloride, and it's just gonna drip it in him the next hour. That's gonna empty it into his system.
But that's not the medication.
No, this is not the medication. We're still waiting for labs to get the right medications and talk with the doctor. Since he does have a sulfa allergy,
Mhm.
we wanna make sure the medication doesn't have any sulfa in it.
Okay.
So we don't want him to have a reaction, okay?
And what was the spitting for?
We're gonna, send that to the lab to see, what antibiotics would work best,
Okay.
okay?
Okay. It sounds like they're gonna get you all together, hon.
That's
Yeah,
right.
I'm hoping I feel a little bit better.
Well, I'm gonna be with you.
Thanks. How's my oxygen level?
It's at 92%, which is pretty good.
Oh, that's good.
Okay, Mr. Wells, I've got your sodium chloride going here, getting fluids inside you. I'll be back shortly, okay? I'm gonna go check with the lab and the doctor's report, okay?
Okay.
I already contacted the pharmacist.
Okay,
So he is gonna be getting, Contamin, and they know that he has a sulfur allergy.
okay, all right.
So
And
go
that has
ahead
no,
and get-
that has no sulfa in it then?
Right,
Okay.
right, and it's 4 milligram per kilogram IV,
Okay.
daily.
Mhm.
All right, so just need to make sure you have the weight and the weight.
Okay, good job, students. We're gonna end the scenario. Thank you very much. If you wanna gather together, all of you, around the table.